So think about being a patient. Have you ever went and sat in a room for 20 minutes and closed the door and did nothing? That's not the way we work. The goal is really not to have an ED waiting room that's so big that it can manage 100 patients, but to have an ED waiting room that's so small that no one is ever in it. It results in the emergency department not holding patients who really require an inpatient bed. It results in patients not sitting in the waiting room waiting to be seen or leaving the organization without being seen. It results in patients getting treated in a more timely fashion, not just in the ED, but in the hospital proper. So the overall impact of what the observation unit can do from a capacity management perspective is viewed very positively by organizations.
My friend brought me up for chest pains last night. Put my social security number in, sat down, and the wheelchair was beside me. And I went in the back.
Once patients come here, then they're seen by a provider, determine then where the patient needs to go. If it's a patient maybe with chest pain or abdominal pain that just maybe needs 24 to 48 hours of additional treatment, then those patients will be sent up to observation from here.
The emergency room is outpatient, observation unit would be outpatient, so it's a very smooth transition from the first floor to the 5th floor.
I've seen outpatient, I've seen inpatient, and I think the difference here is really the pace.
The way we work is continuous movement of the patient with ongoing communication and/or treatment and evaluation. And we do that on average in less than 20 hours, which is pretty impressive when you think about it.
At 12:30?
It's really having that 24/7 care provider there, always available to answer questions, concerns, and communicate effectively with patients and/or family members.
They're in here constantly. I ask a lot of questions, and they ask me a lot of questions. What's it feel like? The questions I want to ask, they ask me. So they're pretty well on top of it.
I'm good, how are you? It's not just competence, we're just compassionate and try to be kind to people. And you need that when you don't feel well.
My favorite thing is being able to see these patients get out within 24 to 48 hours and get them back on their feet to do the normal things that they would do in their daily activities of life.
I'd rather be here to make sure it's okay before I go home.
Patient-centered care is what it's all about. Error-free medicine and patient-centered care. And that should be our focus in healthcare.